Hi everyone, thank you for joining me for part 2 of our edema series. Here I kind of wanted to talk about some of the complications that can happen with edema. So in a nutshell, the fluid that is in edema oftentimes is, backed up lymphatic fluid, a high protein fluid, and it can cause a lot of problems. And this goes for any type of edema that's left to persist in the peripheries for any, for a long period of time. That includes post-surgical or trauma or anything like that. The content of what's in that fluid can be very detrimental to the limb. So I want to show you a couple of pictures to show you what I'm talking about. I guarantee you, if you're an experienced clinician, you've seen some of these skin conditions before. So the first one I want to talk about is this. As you can see here, this is hyperkeratosis. So hyperkeratosis will occur because essentially, that lymphatic fluid contains like some growth hormones, it contains some hormones that are sending signals to the skin. And in this case, the skin is overgrowing on itself again and again and again. You get this buildup of skin on top of itself. A lot of nurses and therapists think that that needs to be debrided. But in actual fact, this is the same leg 7 days later. This lady came into me, and really what we treated her with was compression, a little bit of proximal MLD, and some impregnated gauze, which is basically just Vaseline, on top of her skin. And you can see the difference that it made. So that was a pretty good result. Another condition that you might see is Papillomatosis. So this is those growths that you can see on the skin there. You see that kind of mossy, furry appearance? That is called papillomatosis, when the papillae of the skin, or the mucous membranes, again start to grow and grow and grow on top of themselves. Here's another example of lipedema. So lipedema is a type of edema that affects the adipose tissue and the fat cells, and it presents very, very differently. Let me show you that again. As you can see here, this person has a lot of swelling in their thigh and in their calf, and very, very, very little around the foot area. So that is a hallmark of lipedema. That's pretty interesting, and we get into that a lot in the course. I also want to show you what can happen when you are using ACE bandages to wrap your person with edema. ACE bandages are not recommended for the use of edema whatsoever. Here is a picture that a colleague of mine sent me. You can see that this person has a pressure wound here and pressure wounds here, and that's all from being wrapped with ACE bandages. She also has areas of hyperkeratosis, but being wrapped with that elastic bandage was very, very detrimental for her skin. So I have plenty more of different examples, but I'm not going to go into them all now. Basically, there's a lot of, when you're treating edema the wrong way, there can be a lot of complications. Edema itself can lead to a lot of, strange and characteristic skin conditions and infections. So I do have a couple of articles written on that, and I'll link to them below if you are interested in reading more. So those are some of the reasons that you definitely want to include edema management in your practice. One more thing I'm going to touch on before I go. I mentioned ACE bandages. If you are like me, that's something that you thought was an okay thing to use in treatment. In actual fact, you want to be using short stretch bandages. So see here, the short stretch bandages are woven together. They're not elastic. So you can wrap your patient's limb and provide that much better compression. You're able to, grade how much you're using and give them the exact right amount. And these can be insanely effective in reducing your person's edema. So I'm going to be back with part 3 of our video series. So check it out and tune back in.